And I'd like to welcome everyone this afternoon that that registered for this webinar. I commend you for your interest and motivation in wanting to diversify your workforce. I'd like to thank the Northern Virginia Technology Council for their partnership with the Career Pathways for Individuals with Disabilities grant. I would also like to acknowledge Diane McBride, who is the Workforce Business Manager with the Virginia Department for Blind and Vision Impaired in our Northern Virginia area. Diane contributed greatly to assisting with this presentation and was unable to be with us today, but I do want to acknowledge her part. And so without further ado, we will proceed with the rest of the presentation. Next slide. Okay, what is a disability? If we were to go around our offices or our communities and ask everybody what they consider a disability, you would probably get a multitude of different answers. But for today's presentation, we're going to look at what the Americans with Disabilities, or the ADA, defines as a person with a disability. So their definition basically is saying it's someone who has a physical or mental impairment that substantially limits one or more major life activities. So it could be anything, major life activity being things like employment or recreational activities, educational activities, even living within the home, those activities. Those could be substantial impairments if a person has a physical or mental impairment. Or that person has a record of such, meaning that they have gone to a medical professional or counselor, or it could be a student within the school system that has an individual educational plan, or IEP. It could be a veteran that's working with the Veterans Administration, anyone that has a record of such impairment, or someone that is perceived to be such. If it's a person that thinks they may have a disability, then they would fall into the guidelines of the ADA. Next slide. Who are individuals with disabilities? Well, despite any of the stereotypes or misconceptions regarding what a person with a disability may look like, act like, the reality is that an individual is immune from the potential of developing a disability at any point in their lives. And I'd like to say that all it takes is one event for a person to become a person with a disability. It could be as a result of a car accident. It could be a result of a job injury. It could be a result of even in a recreational activity, say like football player getting injured. If you all remember the late Christopher Reeve, the actor that played Superman for a number of years, he was involved in a horse riding accident over in Charlottesville, and he became paralyzed basically from the chest down, became a quadriplegic, and that's how he was the rest of his life. So all it takes is one event. Many of you are familiar with Michael J. Fox, the actor that was in several movies, those Back to the Future movies, and he developed Parkinson's disease, which is a neurological disorder that has impacted his speech and his ability to be able to control his movements. So all it takes is one event for any person to become a person with a disability. It goes beyond the age, race, economic status, education, personality. And many disabilities are not necessarily visible to the human eye. And we'll be talking about that as we go through this presentation. Next slide. People with disabilities represent the largest minority group in the United States. So currently at this time, there are at least 54 million and probably way more of people that have a documented disability of some type. Now, just 17% of those people are people that are born with a disability, or what we call people that have a congenital disability. those that are again born with a disability. The other 83% are people that acquire a disability. And so this makes becoming a person with disability one of the few minority groups that anyone can join at any time. And again, all it takes is one event, that car accident, that job injury, that fall in the bathtub, that, getting injured, playing sports. You hear about football players that, with head injuries and other injuries. So all it takes, again, is that one event for a person to become a person with a disability. 96% of people with disabilities have what are called invisible disabilities. And so the only 4% of those that have disabilities that you can actually see, that person that uses a wheelchair or a walker, that person that may have a vision impairment where they're using a service animal, or that person that you see that's using sign language. But most people with disabilities, it's their disabilities are not visible to the naked eye. And there's a source that you can check at your leisure from Diversity Incorporated and invisibleillness.com that talks more about those delineation of disabilities. Next slide. Now, hidden disabilities. An estimated 10% of individuals in the U.S. have a hidden disability, okay? Just because you cannot see physical signs of a disability does not mean the disability does not exist. And of course, we have federal and state government agencies like our agency, Department for Aging and Rehabilitative Services, or Department for Blind and Vision Impaired, that provide services to individuals with disabilities to help overcome these barriers and challenges. Next slide. Okay, so what are some of the hidden disabilities? And they fall into really 4 categories, and they can, be elaborated in those 4 categories. We have hidden disabilities that are physical, things like diabetes, especially if they're secondary disorders that are as a result of that diabetes, like nerve pain, cardiac, person that has like heart a condition that limits their activity, or someone that has chronic pain, a person that has like a severe back injury, or a person that may be recovering from, say, a knee replacement or a hip replacement, where they still may have, pain in their joints. That is considered physical disabilities that are hidden. Then we have cognitive disabilities like specific learning disabilities, intellectual disabilities, or attention deficit disorder. Those are considered cognitive disabilities that are hidden. Also, traumatic brain injuries. If a person that was involved in a car accident where they may have hit their head and they've developed traumatic brain injury, or a person that has what is considered Asperger's syndrome or the autism spectrum. And we're going to be, focusing more on autism spectrum as we go through this presentation. Then there are the hidden disabilities that fall into the emotional category, things like schizophrenia, depression, bipolar disorder, post-traumatic stress disorder, PTSD, as well as substance abuse. Under the DSM-4 category, a person that's recovering from substance abuse is considered a person with a disability. And again, those things would not be visible necessarily to the naked eye, but nevertheless, they have been diagnosed with those disabilities. Next slide. Okay, so we're going to talk a little bit about interacting with persons that have specific disabilities. And again, disabilities are as vast as the alphabets from A to Z. And if we were to elaborate on each one, we would be going all afternoon and probably beyond. So we're just going to be focusing on specific disabilities today and interacting with those persons in the workplace. So we're going to start, first of all, with the person who is blind or visually impaired. And I do want to say that there are many people that have a visual impairment that are still able to see to some extent. They may have what is called tunnel vision, or they have lost their peripheral vision, where they're able to, see to the side. but they're still able to see. So what are some of those things you want to keep in mind when we're interacting with a person who is blind or vision impaired? We want to speak as we approach that person. You want to give them your name as you're approaching them so they'll know exactly who they're talking to. Say your name and speak in a normal tone. Don't shout. Sometimes the propensity is when people are engaging with persons who are visually impaired or blind to want to shout at them. They can still hear, many of them can hear quite well, and so you don't need to shout. If a person is using a service animal, allow that animal to do their job without distractions. In other words, don't pet the animal. When walking with a person who's vision impaired, ask if that person wishes to be led. We can't assume that because a person is using a cane or using a service animal that they're able to function, quite well on their own. So we want to, ask if they need assistance. And also to give the person verbal information that is obvious to persons who can see. So say, for instance, if you're at an event and the President of the United States walks into the room and the protocol is to stand, it would be to say to that, blind or vision impaired person, the President has now entered the room, everyone is standing. So they'll know to, respond accordingly. The next slide. Interacting with those that have cognitive disabilities. And these, again, would be people that may have certain learning disabilities, intellectual disabilities. We'll talk a little bit more about the Asperger's syndrome as we go along, but be prepared to possibly repeat parts of the conversation to make sure that they are comprehending what you're saying. Offer assistance on extra time for things like completing forms. Those people might need additional time if there's like an assessment that's part of the application. They may need additional time to take the assessment. Of course, patience, being flexible and supportive, presenting the instructions in simple and understandable format. Sometimes it might involve, having written instructions or using assistive technology, universal design. We'll talk a little bit more about that later on in the presentation, where there are apps that can be installed on iPads and smartphones, iPhones, that will, outline the instructions for that person to follow to perform certain tasks. And the last one is to take time to understand the person and make sure he or she understands you. And, I do want to say that, people with cognitive challenges are still able to follow instructions and follow instructions quite well. We just want to make sure that they understand or comprehend the instructions that are given them. Okay, next slide. Okay, I want to talk a little bit about the autism spectrum disorder, which is a neurodevelopmental disorder that is characterized by persistent deficits in social communication and social interaction across multiple contexts. So people that have been diagnosed with the autism spectrum or Asperger's syndrome, their challenges may be in social interaction, communication, understanding relationships. Many of these people are highly intelligent. They are able to perform very complex tasks. There are many IT companies like Microsoft, several other IT firms that are actively recruiting people on the autism spectrum because they have, minds to be able to process and solve complex coding procedures. Many of them are being used for software development and testing. A lot of people on the spectrum are able to perform repetitive tasks quite well because the more routine that they have in their job, the better it is, for them to be able to adapt. But their challenges become, the social engagement and interaction and communication. Next slide. Really the concern that they have is, you see the quote there from a person who's an autistic person, is having difficulty picking up social cues, and the fear that the way they're going to respond, it could be something that the receiver would perceive as something wrong. So again, it's the challenge they have with the social engagement. Next slide. Okay. So how do we interact with people on the autism spectrum? So we want to make sure that the employee on the autism spectrum has a support in the workplace, so that someone understands that communication may be a challenge for them, such as things like lack of eye contact. Many people on the spectrum are going to have difficulty establishing eye contact. That might be a challenge when they're going for a job interview. They're going to be able to answer the questions, but they may not be able to maintain eye contact as they're answering the questions. Make sure that communication is clear. Some of them will need to be in environments where they cannot have a lot of bright lights or a whole lot of excessive noise. So they want to make sure that we take into account their sensory needs. If a person seems aloof or uninterested in talking with colleagues, or just remember that it's not intentional. If they say something that can be considered wrong, again, it's just due to their challenges with understanding the communication nuances. In this day and age, we use a lot of slang, a lot of cultural communication. So a person with Asperger's syndrome may not understand, when somebody is speaking slang or those cultural nuances. So it's just keeping those things in consideration. Okay, next slide. Some other workplace accommodations, making sure that we clarify expectations of the job, providing training and ongoing monitoring to make sure that they understand the expectations, making sure instructions are concise and very specific. People on the spectrum are able to respond very, very well to specific instructions. Giving regular review of performance and how they're doing. And again, just providing reassurance in stressful situations. If you have a meeting scheduled with the CEO of the company, and that person's going to be a part of that meeting, and just reassuring them that it's nothing to be afraid of. So that reassurance. Okay, next slide. I'm interacting with people who have mobility impairments, and these are the people that would be using wheelchairs as a mode of mobility. It could be a person that's using a walker or some other type of mobility device. If a person is in a wheelchair, you want to sit so that they're eye level with you, as opposed to talking down to them, like standing over them, but establishing face-to-face eye level contact. If you're walking with a wheelchair user, you want to again ask them if they would like to be pushed before assuming that they want to be assisted. Again, many people with disabilities learn to adapt, where they are able to function quite well on their own. Offer assistance with belongings if it appears they need help carrying those items. Don't insist on helping. Many people with mobility challenges, will, if they feel they need help, they will ask, but we just don't want to assume that they need assistance. And the last one, don't lean on someone's wheelchair. It is their personal space. Just like we all, if those of us that don't have mobility challenges appreciate our personal space, the wheelchair is part of that person's personal space. Okay, next slide. Interacting with people who are deaf or hard of hearing. Again, if you want to get that person's attention, you want to tap them on the shoulder or wave your hand to get their attention. And I do want to mention at this time that there are, again, many people that are deaf or hard of hearing that are still able to hear to some extent. Many of those that have limited hearing wear hearing aids that enhance their ability to hear. There are some people that are hearing impaired that have become very skilled at being able to read lips, or follow person's speech as they're talking. But for those, if you're not sure, just tap them on the shoulder or wave your hand to get their attention. You want to look directly at the person, speak clearly, and keep your hands away from your face. If you're a person that likes to communicate with your hands near your face, you want to be careful if you've got people in the room or that are part of a group that are hearing impaired. So you don't want to impede their ability to be able to follow your lips if they're reading your lips as you're speaking. Speak directly to the person, not to the interpreter, if that person who is deaf or hard of hearing is using a sign language interpreter. That interpreter is their mode of communication. So as the person that is hearing impaired or deaf is signing, that interpreter is vocalizing what they're signing. But the conversation is with the person that is hearing impaired. So you want to keep your focus on them. And the last one, use written communication if needed. You'll see down there in that picture that they're using what is called a sign language virtual relay. So you see that a person that is hearing impaired is using sign language to communicate with the person that is on the screen. That person on the screen is giving sound communication to what that person is signing, so that the person on the other end is able to communicate with them. And when they communicate verbally, then the person on the screen signs back to the person that's hearing impaired. So there's all kind of, technology that has, advanced persons that are hearing impaired being able to communicate in a variety of modes. Next slide. We'll talk a little bit about the post-traumatic stress disorder, or PTSD, a disorder in which a person has difficulty recovering after a traumatic experience or witnessing a terrifying experience. And currently in the country right now, there are about 3 million, probably more than that, people in the United States who have been diagnosed with PTSD. Interestingly, it tends to impact women more than men. Now, for a number of years, PTSD was known as battle fatigue because, we thought in society that only those that had been involved in some type of military action where they saw comrades that were, killed or, severely wounded. But we now know that anyone can develop PTSD that has been through like a very traumatic or catastrophic event. In doing some research on this, many of the people that were survivors of the World Trade attack of 9/11, 2001, were later diagnosed with post-traumatic stress disorder because of witnessing or being a part of that catastrophic event. They're finding that people that have been involved with shooting, those people that survived shootings, like the shooting in Las Vegas or some of the school shootings, if they saw classmates that were killed, many of those people have been later diagnosed with post-traumatic stress disorder. From a personal standpoint, I have a family member who found their teenage daughter, her teenage daughter's body as a result of suicide that was later diagnosed with post-traumatic stress disorder. So any catastrophic event could possibly bring on post-traumatic stress disorder. In many cases, those that the disorder cannot be cured. So the best help is through treatment of some type. And we'll talk a little bit about the treatment here in a minute. The condition, again, could last for months, years, or even a lifetime. And some of the symptoms can range from severe anxiety to rage, anger, nightmares, and flashbacks. There are many people with post-traumatic stress disorder on the anniversary date of that catastrophic event. They will go into severe anxiety or very severe stress. Maybe have flashbacks about that event that could cause just them to not even want to get out of bed that day. They just always associate the anniversary date of that event with the seriousness and how it impacted them. Next slide. Now some of the possible symptoms of PTSD, you heard me mention the reliving it, reliving the ordeal through thoughts and memories of trauma. There are people who say may have been involved, say like if there was like a bombing or an explosion somewhere, that they have difficulty even with the 4th of July and fireworks, because just the sound of those fireworks will again cause them to relive those memories of being involved in that explosion, or the bomb that went off, or that if it's a military person that was involved in battle, just those firecrackers will remind them of the sound of gunfire. They may also feel great distress when certain things remind them of that trauma. And you heard me mention about the anniversary date of that event. One of the other symptoms is avoiding. They may avoid people, places, thoughts, or situations that remind them of that trauma. And this can lead to feelings of detachment and isolation from, family, friends, or co-workers, as well as a loss of interest in activities they once enjoyed. Another symptom could be increased arousal, excessive emotions, difficulty showing affection or feelings, wanting to sleep a lot, staying asleep, having difficulty waking up. They could be jumpy, difficulty concentrating. That could also lead to physical symptoms, increased blood pressure, nausea. Thoughts of those events could, cause all types of, both emotional and physical repercussions. Next slide. Some of the treatment recommendations for PTSD. Psychotherapy or talk therapy. And this would involve working with a mental health professional to treat the mental illness. The talk therapy treatment for PTSD usually lasts anywhere from a few weeks to maybe several months, but it could take more time. And research shows that support from family, friends, and coworkers are an important part of this therapy. The other one is medication, and the U.S. Food and Drug Administration has approved Zoloft and Paxil as one of the two major medications, and they're both antidepressants, so that helps to treat the depression part of PTSD. So usually it's a combination of going for the psychotherapy and also being prescribed one of those medications. There are probably some other things out there on the market. Sometimes taking the medications may help them even to be able to better prepare for psychotherapy, because some of that psychotherapy may actually involve talking about how that event affected them. Okay, next slide. Okay, we'll talk a little bit about the assistive technology and accommodations and the universal design. Assistive technology is a commonly used term for technology that's used to assist an individual with a disability on the job. The reasonable accommodation is a term used to provide a job aid or tool to an individual in order to increase the job performance. So let me mention at this point that reasonable accommodations do not negate the person being able to perform the task. The person still has to be able to perform the task and functions of that job with or without reasonable accommodations. So the accommodation is just primarily to help increase their ability to be able to perform that job, to meet the job performance. But it does not mean that that person is exempt per se from doing those job tasks. The universal design is the equipment that is helpful in helping to be able to perform those tasks, and the things like smartphones, iPads, iPhones, other technology devices can be used for the very same thing that pretty much all of us are using now in today's society. Our smartphones and iPads are all considered part of universal design. Examples of like accommodations be like accessible facilities, like bathrooms, common areas, curb cuts where the curbs are leveled to accommodate wheelchairs or people that are using other mobility devices, automatic doors, and many of us use automatic doors if we're coming into a building and we have bags or other items that we're carrying. Another accommodation would be things like job restructuring, job sharing, or reassignment. And again, this does not take away from the person being able to perform the job, but it might just require some restructuring or on that job to be able for them to better perform it. And also flexible work schedules. So say if you're working with a veteran who is diagnosed with PTSD, and they are going for weekly sessions with their therapist, it might involve them coming in, working a later schedule, and maybe working later into the afternoon or evening to accommodate their schedule with their therapist. So all those things would be considered reasonable accommodations to assist a person with disability in being able to perform their job. Next slide. Some samples of technology accommodations. The first slide there is someone that's using what is called JAWS. And JAWS is a software that has a reader device on it for people that are blind or vision impaired, where as they receiving emails, or if they're doing webinars, that screen, that JAWS device reads the information for them. So and so they're able to continue and to communicate and receive communication by using that specialized software. The other slide shows a mouse that is designed for a person that may have mobility challenges using their hands. If a person that maybe someone recovering from a stroke that has limited use of their hand, or someone that has a physical limitation where they might be missing fingers from a hand, they have that mouse there can be activated by using your palm, or by using the tip of a finger. And so those are just some examples of assistive technology devices that can be used to assist people with disabilities in the workforce. In many cases, accommodations are simple and expensive fix that rehab engineers can build and install. Things like an ergonomic keyboard. There are keyboards that have for people that are hearing, that are vision impaired rather, where the keys have larger alphabets on them that make it easier to see, or then have like different colors that makes it more easier for a person to see, especially if someone may have color blindness. So there are all kinds of, again, mouses to software to keyboards that are designed to meet the needs of those in the workplace that might need those accommodations. Next slide. The average cost for hiring a person with disability is the same as hiring a person without a disability, according to most employers. So it really doesn't cost any more in most cases to bring a person with a disability on board as an employee. And these are just some statistics that we got from the Job Accommodation Network, or JAN, we call it for short. 73% of employers reported that their employees really did not require any special facilities at all. Many people with disabilities are able to function quite well in the existing facilities. 56% of all accommodations cost nothing. 38% of the costs are less than $500, and really just a very minimal percentage cost more than $1,000. But you'll notice that over half of the accommodations really cost nothing. And I do want to say that if there are candidates that are working either with our agency DARS or Department for Blind and Vision Impaired, DBVI, we have rehabilitation engineers, fabricators, AT specialists that are able to come in and to assess their work site, the workspace, and see what accommodations are needed. And in many cases, we're able to provide those accommodations. If it's adjusting a desk for a person who uses a wheelchair to be able to fit better into that desk, it might just involve putting, a couple small pieces of wood on the legs of that desk just to raise that desk slightly off the ground. So, accommodations in many cases are very, very easy fixes that cost little or nothing to the company or the candidate. And I do, again, if we can go back to that previous slide for just a minute. I do encourage you to, if you have, questions, the Job Accommodation Network, they're part of West Virginia University. And you can go to that website there, www.askjn.org, and they are a wonderful resource for anything related to accommodations for the workplace. They are the specialists, and we actually utilize their information in our agency in many cases. They're a wonderful resource. Our agencies, both DARS and DBVI, are also available. We have our engineers have many times gone in and taken look at workplaces. If you have people that are working there already that develop disabilities and need an accommodation, we're more than happy to have our rehab engineers come in and assess that workplace and make recommendations for accommodations for that person to continue to work successfully in the workplace. Okay, next slide. And this is just an example of some of the nifty things that our rehab engineers do. This is designed for a candidate who was working as a school janitor with one of the school systems in Northern Virginia. And he was not able to walk long distances. So our rehab engineers took a simple scooter and hooked a device to the back of it that he could put all of his supplies on. Even a trash can, he was able to continue to empty trash cans, put all of his cleaning supplies on there, and still continues to work with that school system. It's actually been working for them now for over 10 years. So those are just one of the devices and things that our rehab engineers are able to do. They're pretty creative individuals, and so to see that innovation does drive inclusion. Okay, next slide. Just a quote I wanted to share from the Association for People with Disabilities. There really isn't a single source out there, not even a dictionary, that is capable of clearly defining who we are as people. It's only when we step out of that labeled box that our abilities begin to be fully recognized, giving a better definition of who we truly are as individuals. And I do want to say that people with disabilities do not want to be defined by their disability, but they want to be recognized for the skills and experience and innovation that they bring to the workforce. Before we go to the next slide, I realized I thought I had included this slide, but I do want to talk a little bit about the CPID grant. This is the Career Pathways Grant for Individuals. This is a 5-year grant that both DARS and DBVI received from the Rehabilitation Services Agency, which is the federal agency that oversees our agencies at the state level. And it's focused particularly on advanced training for persons with disabilities to help them become more advanced, more competitive in the workforce in the areas of advanced manufacturing technology, information technology, and also logistics. We are now into year 2 of the grant, where the focus is on information technology with special focus on our Northern Virginia area. We are beginning to partner and looking to partner with training providers in Northern Virginia that provide IT training. And so if you're interested in finding out more about the grant, feel free to contact myself or Diane McBride. If you're interested in possibly being considered as a possible training provider, definitely contact us. Okay, well, that concludes my part. Are there any questions out there? I will entertain any questions at this point in time.
Thank you so much, LaPearl, for that very informative presentation. So as we mentioned at the beginning of the webinar, if you do have questions for LaPearl, please type them into the webinar tool, and we will relay them to her so that we can keep things moving. We'll give everyone a few seconds, a minute or so to send in their questions. And just a quick reminder that we have been recording this session, and we will be posting it on the NBTC website, and we'll share a link with you afterwards. We also had 2 previous webinars that have been recorded as well, and we will send those links to you in case they are of interest, and you are welcome to share them with your colleagues. And then stay tuned. We are hoping to pull together some additional topics for webinars and possibly even in-person sessions in the coming months. So if you found this session valuable, we look forward to being able to provide you with additional information in the months to come. Michaela, are there any questions? At this time, it doesn't look like anything. Give it a couple more minutes, see if anybody has anything come through.
Well, I do want to say at this point in time, I do want to thank again Allison Gilmore and Michaela and Northern Virginia Technology Council for this opportunity to be a part of this webinar and to present this information. Both our agencies, Department for Aging and Rehabilitative Services and Department for Blind and Vision Impaired, are available to work with businesses in Northern Virginia and around the state of Virginia and advancing and promoting recruiting and hiring of persons with disabilities. We are always looking forward to partnering with businesses that are looking to hire our candidates, and we're always available to even work with existing candidates in the workforce who may develop disability. So again, we do want to thank you for your partnership and your interest in recruiting people to diversify your workforce. Thank you again, and have a great day.
Michaela, if you could advance to the catalog slide.
We actually have a question. If you could please repeat the name of the grant.
Okay, the grant is called the Career Pathways for Individuals with Disabilities. The acronym for us is CPID, but it's Career Pathways for Individuals with Disabilities.
And Michaela, if you could go back one slide. Yes, so there you go. So as LaPearl and I have both mentioned, NBTC is partnering with the state agencies that are running the Career Pathways program, and we've put together a very easy to digest catalog, so to speak, of the services that they can provide companies in their efforts to hire a more diverse workforce. So you can follow that link. You can also find the information on NBTC's website under nbtc.org/tech-talent, or feel free to email myself or Michaela, and we can send you that link directly. So please take a look at that, because as we mentioned at the beginning, the different state agencies that are partnering on this effort have a lot of services that they can offer companies. It's absolutely something you should look at taking advantage of as part of the CPID program and otherwise. Any additional questions, Michaela?
Yes. Do clients of ServiceSource need to get an official disability evaluation from DARS first?
If that person working with ServiceSource has a documented disability, they can utilize that to, if they're interested in applying for a job with the federal government under Schedule A, they can use, that documented disability. They do not have to come to DARS per se, but as long as they have the documentation, whether it be from a medical professional or a mental health professional, if it's a person that is, say if someone at the university or community college that's there under the 503C program, or say a student just finishing school, or is currently in school with in school under an IEP or an individual educational plan. That documentation would also suffice, and also a veteran working with the Veterans Administration. So no, they would not have to initially come to DARS unless they were interested in signing for services with DARS or DBBI.
Okay, that looks like the last question.
Great. Well, thank you everyone for participating today, and thank you to our presenter for all of that wonderful information. We look forward to connecting with you again soon on some of these programs, and have a great day.
Thank you. Have a good day.